media outlet, followed by your question.
Thank you. Good afternoon. Jim Roop with Westwood One News. And we appreciate this daily briefing, by the way. We know how intense it must be to ask questions and have to answer questions about a virus you're learning about in real time. My question is about this homeless situation. If indeed we are providing, the county and the city are providing housing for the homeless who might be infected, when this is over, what happens to them? And if the hope or the plan is for them to remain in housing, exactly what is the plan to facilitate that?
Sure. I mean, I would say that that question is probably best answered by Kevin McGowan and, you know, leadership. I mean, I think everybody right now is just really working as hard as we can to make sure that we can provide as many sheltering spaces for folks who are experiencing homelessness. And I want to differentiate that there's two kinds of capacity that we're building up right now, and the sites will look a little bit different. There's the capacity that's particularly important for us to have for people who we know are elderly and people who we know have underlying health conditions who are experiencing homelessness, and that is to try to get them into a sheltered facility. The other question that you were, the other note that you mentioned, and I think it's an important one, is there are some people who may be experiencing homelessness who may have a test and we may determine that they're in fact themselves positive for COVID-19 and they have some close contacts that we've identified. And I want to assure everyone in that situation where there's a person who's positive, they would not go back to that congregate living situation at the shelter. They would in fact go to housing that's being set up that would allow us to actually do what we ask all of our cases and close contacts to do, be able to actually isolate yourself, and if you're a close contact, be able to be quarantined for 14 days from your last exposure. Obviously, wherever those sites are set up, we will also have services so that people can do that safely and have all of their you know, important essential needs met while they're being isolated and quarantined. This is similar to what we ask every positive case to do and what we try to ensure that positive cases and people who are quarantined are able to do. But I thank you for your question. And I also want to acknowledge and thank the media for really covering this issue with both great depth and great accuracy. We really appreciate that. But we'll take the next question.
Thank you. Next, we'll go to the line of Dave Lopez. Please state your media outlet, followed by your question.
Yes, thank you very much. Dave Lopez, CBS 2 News, Channel 9 News. Two quick questions, if I may. Doctor, can you comment how much faith do you have in this experimental vaccine that the president made reference to today? And will it be enough to slow this down?
You know, the best tool we have sort of in our toolkit in public health is when we can vaccinate people against the disease. So, you know, we all are anxiously awaiting having a good vaccine. And I think as everybody has mentioned over and over that we're really excited when there are promising results, but you need to actually go through a fairly rigorous testing process before we'd be able to offer that to the millions of people who would need to be vaccinated. I just want to really thank the scientific community, the researchers, and some of the funders who have really given a lot of money to accelerate our ability to develop a vaccine. I mean, I always tell people we're doing a lot of social distancing because we don't have a vaccine. Vaccinations actually provide us with a similar tool and ability to protect yourself and protect people around you. In the absence of that, we have to go to the social distancing. But thank you for your question. Next question.
Thank you. Next, we'll go to the line of Annabel Manaz. Please state your media outlet, followed by your question.
Hi, I'm with ABC 7. So the first question is about the number of people that are still out and about. We've heard of hiking trails that are crowded, beaches in Florida as well, many of them young people. So if you have a message for young people who maybe are not concerned about having serious symptoms, what is your message to them as far as protecting themselves and other people? Also multiple questions. The second part is about masks. The CDC, we understand, is saying that healthcare providers can use as a last resort a bandana or a scarf as supplies run short. So where does the county stand right now with masks as well as staffing in hospitals in the county? And the very last question for now, Everlywell, a company, announced that it is going to be offering at-home testing for COVID-19. Do you have a position on whether you would advise someone at home to do that or not?
Okay, great. I will take the first question and the last question, and then I'm going to ask Dr. Galley to address the questions around masks and staffing. So young people, I think, and I'm really glad you raised this, you know, the unfortunate news that we announced today about having our second death in the county was from a person who was relatively young. And while this is not the usual experience across the world and even across the United States, it absolutely is true that there are many, many young people, particularly between the ages of 18 and 40, who are infected themselves, who are having illness, and some of them serious illness, and who, as we've just unfortunately had to report, can die. So I urge young people to take hold of this opportunity that you have in front of you to really do what's right, not just for you, but for everybody who's around you. This is not the time to have a party at your house. This is not the time to go hang out with a whole crowd of people at the beach. This is not the time to be crowding up on our trails, in our beautiful parks. This is absolutely the time for everyone to practice social distancing. This virus has infected thousands and thousands of people all across the world, and a large number of them are people who are young. And for those young people who don't necessarily have serious illness, I can promise you that they're passing it on to other people who are having serious illness. So I know this is hard. It's hard for all of us. It's very isolating. But this is something that everyone has to do. And I'm really imploring those of you who are young to take heed and to help us all. We need your help, and we all benefit from your help. But we need it right now. So thanks. And then in terms of the home testing issue, we've heard of that. I mean, I think there's issues just around making sure that it's a reputable company, that they actually know how to appropriately collect the specimens. While it's not the most difficult task in the world, if it's not done correctly, then when the lab specimen gets to a laboratory, they actually can't test it. And I just want to remind folks that while this bypasses the provider, the labs really are going to be helping us prioritize the fact that when clinical providers ask for a test, that's the most important time for us to be able to make sure we could do those tests. So I understand that people want the home testing, that they want to bypass what they see as an unnecessary barrier for them getting testing, but when we have a limited ability to test people, again, this is an area where we can all be helpful. We can understand what the science says. I'm basically asking people to assume you might be infected. If you're not maybe infected today, you could be infected tomorrow, and you should do everything you can to protect others from getting infected by you, and you should do everything you can to prevent others from infecting you. And you don't need a test in order to do that. So I'm going to now ask Dr. Galley to talk about the mask.
Hi, thank you for the question about the masks. The EMS agency is fielding over 200 requests a day from a variety of healthcare providers seeking additional personal protective equipment. This includes shields, goggles, gowns, gloves, as well as masks. I know there's been a lot of news reports about N95 shortages. There are projected shortages, though additional volume is coming out of state and national stockpiles, and I know there are efforts to ramp up manufacturing in this area. In terms of what's clinically needed, the best available evidence at this time, which has been supported by a variety of clinical research papers that have been peer-reviewed is that this particular virus is spread through respiratory droplets, large droplets. And because of that, surgical masks are effective in stopping the transmission of the virus in the vast majority of cases. The exception to that is when an individual in a healthcare facility is undergoing an invasive procedure, an invasive pulmonary procedure like a bronchoscopy or something similar to that. In that setting, the virus might become aerosolized. There was a recent study that many people have referred to recently in the New England Journal of Medicine, which shows that if you try to aerosolize the virus, it can be found in the air. That makes sense. It's common sense. If you push the virus into the air, it can indeed be aerosolized. In those clinical settings that mimic that specific situation, healthcare workers need to have an N95 on to protect their own personal health and safety. There are also other bacteria and viruses out there, such as the measles, tuberculosis, which we know are airborne transmitted and which we know healthcare workers need to have N95s for. So the best guidance right now that's out there and what is being put forward by the World Health Organization, as well as many other public health authorities, is that respiratory droplet precautions be used, which include surgical masks for individuals to prevent normal transmission, and that the N95s be reserved for those specific circumstances in which they're clinically indicated, which is what I briefly described. If we follow that, we can make sure that we are protecting our workforce for the specific situations in which they might be prone to a workplace transmission of COVID-19. Is there another question?
Thank you. Next, we'll go to the line of Robert Garova. Please state your media outlet, followed by your question.
Thank you very much. Yesterday, you said the to collect specimens looks like it's going to work, and we're going to increase our capacity. So my question is, if you can get a timeline on when that will happen, how many drive-through centers there will be, and where they will be, and then I have a second question after that.
Sure, and thanks for that question. Yes, we are increasing our capacity to do drive-through, not just at the Public Health Department, but across the entire county. We have been very fortunate to have Dr. Kazan from the fire department, the LA County Fire Department. He's the medical director there, sort of agree to really spearhead our efforts to both understand what the capacity is and help enhance the capacity in LA County. So I'm hoping at some point, perhaps tomorrow, he'll be able to speak with you and announce what the system looks like today and what it's going to look like as we continue to get enhanced capacity across the county. We take the next question. Oh, sorry, go ahead.
My second question was your guidance to medical providers today talked about public health shift from a strategy of case containment to slowing disease transmission and averting excess morbidity and mortality when it comes to testing. Can you explain the reasons for that shift?
Yeah, so I want to clarify. We're going to continue to do case containment. Like, that's a strategy we always do. The shift is that we now have to add a lot of other measures. Some of them you hear us talk about all the time that are social distancing. Some of you've heard from Dr. Galley, which are just building capacity in our healthcare system to anticipate an increased demand for services. We don't want to be behind on any of this, but I do want to clarify, we will still identify positive people. We will still ask people who are positive to isolate themselves. We will still find their very close contacts, particularly their household members, and ask them to quarantine. And we'll continue to do investigations of disease outbreaks in our institutions. So I don't want people to think we're not doing that anymore. What we're doing is just adding capacity to in other places and spaces, and part of that is really asking the public in particular to help us with strategies that can only be done by everyone. At some point, your case count gets way too large to just rely on our ability to be able to manage interviewing people in a timely way, particularly the focus on close contacts. And what we'll really end up doing is being able to identify folks get them to isolate and get them to help identify close contacts who will quarantine, and really focus efforts on preventing outbreaks in larger institutions. So this is the time for all of us to do everything we can to support all of the various efforts, but I want people to know public health will always continue to identify positive cases and to make sure that those positive cases are in fact isolated. Yeah, and Dr. Galley is going to comment as well.
I just want to make one comment on my previous comments before we move to the next question, just to make sure there isn't any confusion. When I was referring before to the virus being able to be aerosolized and being found present in the air, that's only in the context of a clinical medical setting in which there are specific interventions being done to push the virus into the air or doing something that might push the virus into the air. The virus is not airborne outside of those settings. It's not out there in the air as you're going for a walk in the park or a walk around the block. The air is safe to breathe, and there's no indication and no clinical need to wear an N95 or a mask if you're just out in the general public. Is there another question?
Thank you. Next, we'll go to the line of Claudia Pashuta. Please state your media outlet, followed by your question.
Hi, Claudia with KNX Radio. Barbara, I have 3 questions, but 2 of them I think are little or short to answer. Have you had any positive cases in the homeless population or in the inmate population? And if so, will you be identifying them when you put out the daily numbers?
It's a good question. The answer is no, but that's just the answer in this moment in time. We have investigated possible cases in both settings, both for people experiencing homelessness and for people who are in the jails. None of them to date have been positive. All the testing we've done has been negative, but I don't want anybody to take a sense of relief that, well, maybe this isn't going to happen in those settings. That absolutely, as with all other settings in LA County, it is highly likely that we will see positive cases in both groups, and that Dr. Galley could talk more about this. Certainly, correctional health is doing an excellent job managing both isolating folks when we're waiting for their test results and quarantining close contacts should we have positive cases. So I have a high degree of confidence in correctional health, and because we've worked with them on other outbreaks. So they do an extraordinary job managing cases and close contacts in very difficult situations in our jails. We are set up, as I noted before, should we have positive cases for people experiencing homelessness. We do already have places where people can go and they can be isolated and quarantined, but done so safely and with a whole set of services. So we're prepared. We haven't had any cases to date. The second question?
Okay, and what do you mean by mild symptoms?
Yeah, that's a great question. So mild symptoms would mean that, you may have a low-grade temperature around 100. It may mean that you have some aches. It may mean that, your throat is sore. It may even mean you have a mild cough, but you're not coughing so hard that you're having trouble breathing. Moderate and more severe symptoms, are both, higher temperatures, but also a rapid rise in temperature would be a cause of alarm. And particularly for respiratory illness, we worry a lot when people are coughing so hard they can't catch their breath, or it's feeling very, very painful for you to breathe. And this, the distinction between mild and moderate illness, it's really appropriate for most of us, but I want to emphasize that if you have an underlying health condition and or you're elderly or you're pregnant, even with mild symptoms, we ask that you please call your doctor and check in.
Gotcha. Okay, here's the longer question. Given how long it's going to take to get a vaccine, we've heard potentially a year, year and a half, how long do you think people should be thinking about severe suppression measures? Is this something you're taking on a day-to-day basis, or are you already thinking this is something that's going to go on for weeks or months, be eased a bit, and then become more severe depending on what happens with the case numbers? How are you planning for that?
You know, well, because we're public health, we have to plan for the worst possible scenario, and then, you know, be very prepared to shift to much better scenarios. So yes, from a public health perspective, because it's a new virus, we're going to plan for this lasting for weeks and even months. What we're trying to do is make sure that while we're experiencing a rapid spread of COVID-19, we're doing everything we can to protect our healthcare system by slowing the rate of that spread. And having that spread happen over a longer period of time. But I think I've been really honest with everybody from the beginning, both that we don't know everything we wish we knew, and also that there's absolutely no example I can point to anywhere in the world that would let me believe that we're going to do this for 7 days or 10 days or even 2 weeks, and then life is going to return to the normalcy that we all had a few weeks ago. That's just not possible, and it's really not likely. How long we have to do significant suppression, I think, is a question about how well we do with the suppression we're doing now.
And so do you foresee a scenario where maybe some of the restrictions are eased, and then depending on what happens with the numbers, maybe we see more requests to ask people to stay at home again, and, you know, will it go up and down like that?
Yeah, that's always possible. You know, those of us who are in public health, we're looking anxiously at what's happening in mainland China, where they have eased some of the restrictions and they got many people back to work to see what the experience is. I want to remind people the reason there's so much uncertainty and the reason I say, like, it's, you know, it's hard with a new virus is there's no people in our communities, except for those who have already been infected, who have any immunity to COVID-19. So that's what makes this so different from other situations. And, you know, some people say, like, you know, if you really want to guarantee that, like, you know, we're not going to see these ebbs and flows that you're talking about, you'd have to have had a lot of people who had an exposure that resulted in their immune system being activated. And because we just don't know this, I like to tell everyone, you know, let's do everything we know how to do right now. Let's do it really, really well. Let's be attentive to the data and the experiences in other countries, but let's give it our best shot right now, and let's really dig in deep on the social distancing. And I'm gonna note that we can only take one more question, so the next one will be our last question, and then we're gonna, for everybody who's been so patient, we will do a brief review of the information in Spanish.
Thank you. Next, we'll go to the line of Steve Gregory. Please state your media outlet followed by your question.
Yes, hi, Doctor. It's Steve Gregory, KFI Radio. Thanks again. So I want to talk a little bit about numbers, and I want to find out if you think it's necessary to every day give us the numbers and why you think it's important. People need to hear these numbers every day of cases. The other thing is the Centers for Disease Control, they put out their numbers, but they seem to be a little behind, and there are multiple sources apparently for positive cases around the country, Johns Hopkins, CDC, WHO. Who do you use as the agency in Los Angeles County? Who do you use for the ultimate sort of clearinghouse for data? We're trying to really figure out where are the most accurate figures coming from when it comes to positive cases. And do you think that we should be promoting those positive cases on a daily basis?
You know, it's a great question, and I think I'm going to try to answer the first because I think it informs how we think about the second. So what's the advantage of letting people know every day the number of positive cases? You know, I think at this point we'd like the public to be assured that the information we have, they're able to access, and that's why we do it. We know that there's a lot of anxiety. We know that people are very worried. And we know that one question on the hearts and minds of so many people in LA County is what is happening with the number of positive cases. And we're happy to provide that information. You'll also notice we use this as an opportunity to talk about all the other issues that really we like your viewers and your listeners and your readers to pay attention to as well, because this is an opportunity, thanks to all of your cooperation, for us to be able to talk about how people can take care of themselves and the people they love and those most vulnerable. I will say there's always this limitation on reporting numbers, because sometimes it gives people a false sense of security. You know, it was our fear when we started reporting the numbers by the cities, was that people would look at it and say, well, this isn't in my community, so I'm not going to do anything that they're telling me to do because there's none of it here. And that's also the problem with the case counts, is it's an underrepresentation for sure of the actual number of cases in any community, and certainly across LA County and the country as a whole. And everyone has said that if you have limited testing and you also have a lot of mild disease, which means people may think, I just have a cold, this is my usual, you know, March cold, I'm not going to worry about it, which is very appropriate. In this case, it may not be the cold. It may actually be a mild case of COVID-19. So knowing that, and knowing that we've had a lot of testing limitations, means that what the numbers don't tell you is the true experience of how much community transmission we have and how many cases or how many people in our community may be positive. So knowing that, I'll go to the second question, which asks, so, you know, where are you getting your information from? One thing I want to note is everybody must report to their local public health departments all around the country positive cases. And if you're looking for reliable information in LA County, we confirm all the cases, and any data we give you are for confirmed cases. We also work closely with our state Department of Health, the California Department of Health. We all feed our numbers to them. So I would say state numbers are very reliable, local numbers are very reliable. Sometimes there's a lag with reporting to CDC, which is why sometimes if you were to add up all of the state numbers, they wouldn't exactly match the CDC numbers. But I do know that the local numbers are very reliable from local public health departments, and the state numbers tend to be just as reliable because they are collecting the information from the locals. So thanks for your question. I think we're now going to go and switch to Spanish. I guess, do we need to give everyone a minute? We're good to go. Okay. So, buenas tardes a todos. Hoy estamos reportando 40 nuevos casos. Estamos tristes de reportar una muerte adicional hoy. Esto lleva el conteo a 2 en el condado de Los Ángeles. Quiero expresar mis más profundas condolencias a la familia y los amigos. Lamento mucho su pérdida y nosotros como comunidad lloramos con usted. El número total de casos en el condado de Los Ángeles hoy en día es 230. Todos los casos confirmados están siendo aislados y los contactos cercanos están en cuarentena. Veremos un aumento en los casos positivos probablemente para las próximas 4 hasta 12 semanas. Pero eso no significa que nuestras acciones para combatir el virus no están funcionando. Sí están funcionando. Y es bien importante que para todos practicamos el distanciamiento social. Debemos emplear precauciones en todo lo que estamos haciendo. Una forma de tomarnos en serio la desaceleración del virus es que todos practicamos el distanciamiento social y cumplamos con todas las órdenes y las pautas que estamos dando. Debido a que COVID-19 está muy extendido, como regla general, debe asumir que puedes estar infectado y que otras personas a su alrededor están infectadas. Y actuar con esto y a tomar todas las precauciones posibles para evitar infectar a otros y evitar infectarse. Si todos adaptamos esta mentalidad y luego actuamos lo que estamos pidiendo, reduciría la propagación de este virus y mantenemos a usted y a su familia más seguros. Quiero hablar por un momento de la necesidad que todos estamos aquí juntos y tenemos que cuidar uno al otro. Si nosotros necesitamos cuidarnos y cuidarnos a los unos que están alrededor, porque este tiempo es un tiempo bien difícil para mucha gente. Si usted o un miembro de su familia tienen síntomas leves, puedes hacer algunas cosas en casa para cuidarse. Descanse, bebes mucha agua y controle su fiebre con Tylenol, si es seguro para que usted puede tomar Tylenol. Aislar durante 7 días, utilizando su propio baño si es posible. Es bueno hacer planes ahora para que estás preparado para esto, si esto se empieza en tu casa. Si tú te sientes mal o tienes un hijo o un miembro de tu familia que se siente mal. No comparte utensilios, tazas o alimentos con otros. Si usted es un cuidador de niños o de gente que son más ancianos, trate de encontrar a alguien más en su familia para que ellos puedan hacer el cuidado a todos. Y por favor, no evites de preparar o servir comida cuando tú estás enfermas. Si sientes que necesitas ver a un médico, por favor, llames antes que ingresar al hospital o al clínico. Es especialmente importante que las personas mayores y las personas que tienen problemas de salud graves se quedan en la casa. Le pido que a todos de nosotros que tenemos familia, que quizás están ancianos o quizás tienen que quedarse en la casa, que le ayudamos para que ellos sí se pueden quedarse en la casa, porque nosotros estamos ayudando para que ellos no tienen que salir para hacer las compras. Si necesitas hablar con alguien porque tienes mucho estrés, puedes llamar a la línea de ayuda 24/7 del Centro de Acceso del Departamento de Salud Mental del Condado de Los Ángeles. Ese número es 800-854-7771. Muchas gracias. Y puedo coger unos pocos preguntas también. Tenemos tiempo, ¿verdad?
Grace, we will take any questions in Spanish now.
Thank you, ladies and gentlemen. If you wish to ask a question, please press 1 and then 0 on your telephone keypad. You may withdraw your question at any time by pressing the 1-0 command. If you are using a speakerphone, please pick up the handset before pressing the numbers. Once again, if you wish to ask a question, please press 1 and then 0 at this time.
También le quiero decir que si quieren hablar con una persona después, pueden llamar a la Oficina de Comunicaciones del Departamento de Salud Pública y podemos tener a otra persona que te puede hablar también más tarde por hoy. Y se parece que no hay preguntas hoy, so muchas gracias a todos.
This concludes our press briefing for the day.